హాయ్ ఫ్రెండ్స్, వెల్కమ్ టు RKHC. సో ఈరోజు ఈ వీడియోలో నార్సెట్కి చాలా ఇంపార్టెంట్ ఇమేజ్ బేస్డ్ క్వశ్చన్స్ చూద్దాం. ప్రతి నార్సెట్ ఎగ్జామ్లో 3 to 5 క్వశ్చన్స్ అయితే ఇమేజెస్ నుండి షూర్గా వస్తాయి. జాక్సన్ ప్రాట్జైన్ ఎక్స్రే షోయింగ్ కరెక్ట్ NG tube placement. Ileal conduit. Bayer hugger. Pulse oximeter. Non-invasive ventilation mask. Kerning sign. Cullen sign. Case tube. Bone dehiscence. Decorticate posture. Suprapubic catheter. Nephrostomy. Logan bow. Vasculatarius muscle. Negative pressure wound therapy. Bulb syringe. Umbilical cord cutting scissor. Sangestecan Blackmore tube. Dorsogluteal side. Phototherapy machine. Bronchoscope. Malicot catheter. Dry gangrene. Heart lung machine. Catheter mount. Vaccine vial monitor. Non-pneumatic anti-shock garment. Nasopharyngeal airway. 2-way syringe. Eval's tube. Rosello tape. Beam balance. Pain scale. Whole bank logo. Electric encephalography. Wet gangrene. Anterior venous graft. Under 5 clinic. Trias color code. Intercostal drainage. ETA tube cuff pressure manometer. USG machine. Spirometer. Flow meter. Oxy hood. Venturi mask. Partial rebreather mask. Blood culture bottle. Second degree burn. Burn classification. Ripple bed. Appendectomy. Bone marrow biopsy needle. Tuhoy needle. Laminar flow hood. Hot air oven. Magili forceps. Tripod position in epiglottitis. This is used for holding swabs. Used to remove applied bandages. Mainly used for measuring ng. Uterocervical length. Milwaukee brace used in treatment of spinal curvature. Hernia mesh. Branch traction. Skeletal traction. Cautery. Doyen retractor. Pinard's fetal stethoscope. Cheetal forceps. Crystolithotomy forceps. Morris retractor. Mollison's self-retraining master refractor. Kelly's rectal speculum. Uterus holding forceps. Which among the following depicts the correct fitting face mask used during neonatal resuscitation? Alice tissue forceps. Kocher forceps. Sim speculum. Green Hermitage forceps. Cervical punch biopsy. Antoius cup. Uterine polyp forceps. Nephrolithotomy forceps. Insertion of ET tube. Stage 3 bed sore. Sign of hypocalcemia. First degree bed sore. Breath analyzer. Intradermal injection. Protein energy malnutrition. Subcutaneous injection. Spina bifida occulta. Chest X-ray showing correct tissue placement. Gidial airway. Leopold's maneuver. Plasma apheresis. Cardiac monitor. WHO's pain relief ladder. Central line. Ishihara chart. Eurometer. Supraglottic airway. Teletherapy. Invasive baby monitoring. Defibrillator. Intercostal drainage. Apical pulse checking. Evisceration. NSV set. Goniometer. Vein circuit. Romovic drain. Decerebrate posture. Strip thermometer. Asepto syringe. Dosimeter. teletherapy, Montgomery straps, neurostimulator, Swan-Ganz catheter, WHO logo, CPAP mode ventilation, fetal Doppler, ambu bag, DVT pump, lumbar puncture needle, infusion pump, fetal activity monitoring, glucometer, Murphy eye, Salter scale, Heimlich maneuvers, electroconvulsive therapy, nasal cannula, Harpenden caliper, blood sample vial color code, tube needle for epidural anesthesia, needle for liver biopsy, arterial blood gas analysis, anesthesia machine, photoscope, pediatric drip set, feeding jejunostomy, humidifier, invasive blood pressure monitoring, infantometer, tracheostomy, Holter monitoring, renal biopsy, percutaneous transeptic biliary drain, intraosseous infusion system, bone marrow biopsy, hemodialysis machine, autoclave, emergency trolley, peripherally inserted central catheter, dialyzer, squatting position in tetralogy of Fallot, used for holding suture needle, IT retract anterior wall of vagina, Dunlop's traction, Hamilton Russell traction, surgical blades, uterus holding forceps, Desjardins, cholecystectomy forceps, Shirodkar's cerclase needle, C. Russian forceps, self-retaining Jolly's thyroid retractor, ABG sampling, 90-90 traction, Pessary, nasal speculum, bone cutter, intestinal clamps, Medzenbaum scissors, curved mosquito hemostat, iris suture scissors, Babcock forceps, Cusco's bivalved speculum, Valsellum, Simpson perforator, Bust-Cepsiostomy scissors, Cheetle forceps, pacemaker, stage 4 ulcer, bogey, stage 2 ulcer, ventilator, supraglottic airway, Brosello tape, Shakir tape, tracheostomy kit, knee CPM machine, peritoneal dialysis set, ostomy pouching system, types of fracture, Foley's catheter, cardiac monitor. Thank you for watching guys. Please do like, share and subscribe our channel.